Hey, Melanie Nelson, Director of Sales with TLS, which is our sister division. We go together, like I say, like peanut butter and jelly on whole wheat bread, TLS and nutraMetrix. Thanks for joining me today, Melanie.
Hey, thanks for having me, Sarah. Super excited to be here, talk about our divisions and how they complement each other.
Yeah, I want to speak to the nutraMetrix consultant, to the nutraMetrix health professional, to the person who's building their own franchise in a professional way and understanding that there's some really unique opportunities to leverage other majors. And I think these two majors go together so well. But what do I need to know? Like, give me the down and dirty. What is TLS if I'm brand new?
Yeah, absolutely. So TLS stands for Transitions Lifestyle System, and it's a comprehensive four-pronged approach to a healthy lifestyle with multiple plans. So patients and their practitioners can find their fit. And that's really the four prongs are low glycemic impact eating, which is, something that's been studied for over 40 years as one of the healthiest ways to eat because it manages those blood sugar levels. It was created, TLS itself was created by doctors to prevent lifestyle diseases like diabetes, also assisting in reducing the inflammation marker in the body, CRP. And so it's just a really fantastic way for all people, really. There is no contraindications to eating the TLS way. The second approach is, or the second prong is body composition. And we achieve that through, obviously, low glycemic impact eating, our supplementation, which is our third prong, but also through, obviously, exercise. And so fitness. We don't have a strict program, so to say, in TLS because we don't want to eliminate anyone from our program. Some people just need to start walking around the block in the morning and the evening. And some people are engaged in, P90X, fantastic. Keep doing whatever you need to be doing. But we really encourage people to find their fit within fitness. And that is an incredibly important part of maintaining that lean muscle mass and that ideal body composition, which, leads to a long life of vitality and longevity versus being at risk for a lot of diseases when we have that increased body fat percentage. And then number three is, as I mentioned, supplementation. Our science-backed supplements, our line in TLS addresses different factors, Sarah, that contribute to the struggles people have with weight, whether that's hormonal or addictions to carb or stress or needing support with body composition. We have a product that addresses pretty much all of the major bases there. And number four is education, which we'll address here later today, but also just in knowing why you're making those changes. I know that when I first educated myself on healthy living, I had grown up on, what was it? Captain Crunch in the morning, mac and cheese in the afternoon, and meat and potatoes in the evening. And that's what I grew up in. I didn't think that was unhealthy and I didn't know any better. And of course, was overweight. And when I learned about healthy living and eating, and I realized like, wow, this is what I'm doing to my body, it was so easy to make the choices I needed to make versus what we would just call behavior modification.
I know what you're saying. Yeah. And I mean, I think this is so huge. And there's a lot of providers that, throughout the ages, they've just said things like, eat less and move more. It's calories in, calories out. Or, here is the government, my plate, or the food pyramid as it used to be. And, this is what you need to do. Or some of them, subscribed to a fad diet. And so then they told their patients about such fad diet, and that's what their platform was. So, why do you think that health professionals today need a program like TLS?
Oh my gosh, there's several reasons. The first one is I feel like I just want to speak to the NCs and the HPs and the UFOs on the line who are listening, that if you share a goal for optimal patient outcome, if you share a goal to provide foundational solutions, not just Band-Aids, a goal to educate a healthy lifestyle, not just a fad or, those types of things, because there is a need for this. There is a market for this and people are buying. They are, whether a health professional is offering education or solutions or not, people are looking for them. 77% of Google searches are done for health and weight loss reasons. And so people are really looking, and then they go and they buy junk science at the Walgreens and the Walmarts and the CVS's and the, late night ads and infomercials and, the advertisings in the beauty magazines. I mean, they're spending money. And they're often creating a detrimental effect in their body with yo-yo dieting and the latest fad and the latest celebrity, the latest superfood, that Dr. Oz talked about, or, with those types of things. And so as a health professional, I think that it is so important to provide the patient base with a systemized approach that actually works, that is surrounding a lifestyle they can maintain, which really is the key to, again, longevity. Again, if we talk about fad diets and what happens damaging hormonal health, metabolic health, what I love about TLS is that it's supporting all of health. So unlike diets where, and I know I'm speaking to the choir here for everybody who's listening, done a diet, you feel hungry or hangry. You're cranky, you lack energy, you're deprived, it's no fun at all. And like, we're running a group with TLS right now. There's over 400 and some people on it. And all the posts are, I'm so happy. I feel amazing. I have so much more energy. I can't believe it. We're 4 weeks into a 6-week program, and they are all just talking about how good they feel. And that's what happens when we support the body from those foundational principles, where we can really create wellness, a wellness system. And why TLS is so great for HPs specifically is because it's systemized and it's turnkey. As a nutraMetrix health professional, you get a TLSslim.com website. You have access to all the free tools and downloads that you can print off for your patient base. You don't have to reinvent the wheel. You don't have to create your own handouts. Now, obviously, if you want to tweak or customize a bit, you can.
Totally can.
But
yeah,
totally can. But these are beautiful. They're branded. They're systemized. Menu plans, recipe booklets, all kinds of product infographics. You name it, it's on that TLSslim.com site. So whether an HP wants to do in practice education and accountability, whether they're coming in monthly or weekly or whatever the case, or if they just want to farm it out to like online and a little bit more hands off. We have systems for all of that. And then you're creating this leveraged ongoing income with a systemized approach. So it actually saves you time and makes you more money. And that to me is just a no-brainer.
that's what everyone's looking for. And right now, a lot of practices are looking for something that they can add to their practice that's going to make them more money. They're looking at things like acupuncture services, in-house diagnostics, aesthetic services. Again, a lot of those can just be more trading time for money. And, another thing that I want to talk to is how you think that health coaches have a role in today's weight loss market. So let me put a little bit more color on that for you. And thinking about, I think that, in the general health coach space, a, certification as a TLS weight loss coach is a type of those coaches. And a lot of practices I'm seeing are looking to outsource components or, hire some staff to help run some components, more not a physician extender or a coach's role. And Melanie, you're as much of an entrepreneur as I am. So I'm always thinking, how can we scale this? How can we leverage this? So tell me a little bit about what you're hearing about, the health coach role and how TLS plays with that.
Yeah, absolutely. Well, we have a certification. So if you wanted, if a health professional wanted a staff member to become certified in TLS, that's something that, can be can happen and can be arranged. And, or an existing health professional in the office, like an RD or something like that, is a great candidate for TLS. And, truly it's just prime time right now is prime time to have this type of health coaching. There's more access to information than ever. Right. So people, they go, Dr. Google, tell me what's going on. Right. And we know in the health industry, that's a big no-no, self-diagnosing and all that crazy stuff. Right. And so, but with access to more information also comes more confusion. And this is where I feel it's important to have that certification and also those types of health professionals in the field to be a source of solid information where, we can clear the fog and the confusion and bring people a solution and a system, because this is $1 billion market and people want a guide. That's what they want. They want to be, some people want handheld. Some people just need some direction. Some people just need some encouragement. Some people need some tough love, whatever the case might be, people are looking for a guide, and mass marketing is out. We're no longer interested as a culture in mass marketing. We really want that one-on-one referral approach, that type of thing. And that's where health coaching comes in. That's where being a certified TLS coach is such a great option. And as a health professional, you could even become a certified TLS if you didn't even want to farm it out, right? So with our business, it's great to leverage that certification with someone on your staff or yourself, but also that we can build a team of coaches. That's even more exciting because you can partner with other health professionals that are within your community or your city or your state, or just, ones you're connected with all over, and build a team of health professionals where you're just creating that ripple effect of positive change throughout the world, but also be leveraging other people's time and effort. If they're health coaching, you're benefiting 100% from that within our structure in our Market America Unfranchised business. So it's really quite something what we can do here, because I can't remember who said it, but I'd rather have 1% of 100 people's effort than 100% of my own.
I think it was J. Paul Getty of Getty Gasoline.
There you go. That's who it was. If you're right, I don't remember who it was. So, but it's the reason why we build teams in this business and why we leverage ourselves. So don't think about just your office, your health practice. Be thinking about who do you know? Who do you know who could be and partner with you and spread this and spread leverage and abundance. So
yeah,
it's good.
Yeah. So in our health professional channel, we call it TLS Select, but it's just built on the principles of TLS. We also, with a lot of our providers, will incorporate GeneSnip, which is our nutrigenomic testing product. And then we encourage our health professionals to, while they're waiting for the results of the test to come back with the GeneSnip DNA analysis, to run a TLS program, even if it's just a 30-day jumpstart, even if it's just the 7-day detox, or utilizing the guide and journal. We teach all this in our training, the TLS Select and GeneSnip 101, 201. But if you could speak to a little bit of the education that you're running with TLS, that would be really helpful.
Yeah, for sure. I mean, now we have a TLS 101 and 201 as well. And you can look into the back office, your UFMS, and go into meeting search and search for those TLS 101s and 201s. Now they are happening online now, which is fantastic. So you can plug in from anywhere. And so we have an incredible faculty of trainers, and many of them are nutraMetrix health professionals. And so because we are such a connected divisions, and so we have those. I know it's Q4 currently, and so we have one coming up in November and one in December. So we're doing them regularly, and we absolutely, that's actually one of the requirements of the certification, right? Just like pretty much all certifications, it's field work, training, field work, and testing. And so we have those three components as well. Now, to get people started in the moment, right? Because November, it's 14 days away or a month away in December. In the moment, it's possible to become educated right away. Our website is full of all the information one needs, as long as you can click and read. The free resources are incredible. So if you click on that resources tab and you just look through those tabs there, incredible information. If you take, and I think there's always something really important when you make it personalized. It's never more important to you when it's about you, right? And so I encourage all my health professionals to take the TLS profile and learn what program would be a fit for them based on their goals, which products would be a fit for them, and start with those, because it's like, oh, well, these are a fit for me. So those are the most interesting to learn about first. Mm-hmm. So I always encourage that. Our YouTube channel, we have an official TLS weight loss solution. And we also have one to support coaches. So we have those two, and lots of videos on there to start educating. Also our social media channels and our blog, it's all there. I mean, we have so much education. We just did a great blog on the truth about fat. It's a part 1, part 2 series. We did a great blog on what do these little treats and cheats actually cost us long-term, right? How does it all calculate up at the end of a year, kind of thing? And so it's just really interesting information that you can leverage, not only, leverage in the sense of education for your own self, but to just pass it off to your patient base and be like, read this, right? And it's so leveraged in that way. And so TLS is full of education. We do have our journal as well, which is, we sort of, what do we call? We love our journal.
It's really impressive. I have a provider who just started a TLS program in her office. And when she received the journal to start promoting it, she said, I can't even get over how robust this program is. To hear feedback like that is so wonderful and just shows the power, and that it's so different than anything else that's on the market today.
Absolutely, for sure. So to come back to the certified coaching process, because, the 101, 201 is the first, the training, but field work is working with at least 10 clients or patients that you're bringing through a TLS program. And, that can be really simple for a health professional to do, to put a group together, and then take the exam once the application is submitted. And so anyone can download the application from the unfranchised back office and start to fill it out as they do what, check the boxes essentially. And we have, so between nutraMetrix and TLS, there is, abundance of education for people to move forward.
It's so helpful, Melanie. Well, I encourage anyone who is majoring in nutraMetrix to either double major or at least minor in TLS as part of our university system. I think that these two divisions go hand in hand. You need to follow TLS on social media. As Melanie says, do a little bit of R&D, rob and duplicate, send that out to your own patient base, your own customer base, and make that a part of it. And I really hope everyone here takes advantage and sees you soon on one of the 101s, 201s. And I appreciate you so much, Melanie. It was great to see you.
Thank you, everyone. Thanks, Sarah.